We come to the fourth part. Here, the presenting symptoms are typically the throat complaints. This is also one of the most commonest presentations that I have seen in today's times, and that is of throat complaints. Many patients are just describing that I am having a lot of throat complaints. I'm going to show you one or two cases, and then I'm going to try and tell you how and what we are doing and how we are helping patients with this kind of situation. So this is one of the cases, very beautiful case of a young man, about 25-year-old. He's COVID positive, fever since last 3 days, lot of coryza. The main symptom, coryza is periodical. Typically at 7 p.m. at night, he gets coryza. But he says that my main symptom, he says, is that I get a lot of itching in the throat. Lot of itching in the throat and palate. Dekho. Lot of itching in the throat and palate. And lot of dryness. And there's a lot of hawking and hemming like that. And when he drink warm, he feel better. Lot of weakness all over the body. Lot of tired feeling. Thirstlessness, constant feeling I'm going to fall sick, I'm going to fall sick, I'm going to fall sick, something's going to happen. And lot of itching in the throat. The remedy, and after taking entire history, this was the main intense symptom for him. So the main remedy for me to give in this situation, yes, is the remedy, very beautiful remedy which I want to show you. It's a little lesser known remedy, but you can use it a lot. It's known as Vyathia. Yes, the name of the remedy is Vyathia. It belongs to the Arnica family. Vyathia, you can see it's written. It has a marked action on the throat, has a proven excellent remedy in pharyngitis, especially the follicular form, and very irritable throats of singers and speakers, and a lot of itching also in posterior nerves. Constant clearing and hemming. Which remedy has the maximum clearing and hemming? Maximum clearing and hemming. Tell me. There are many remedies. I'm going to tell you a little lesser known remedy. Okay. Dekho. Hepatica. What's the remedy? Dekho. Hepatica. Boric. Kholo. Hepatica. The most scraping and rough sensation in the throat in boric. Okay. This is one of the only remedies where scraping and rough sensation is written in capitals. Hepatica. Dekho. Pharyngeal catarrh with profuse serous sputum, hoarseness, tickling, irritation of the throat, scraping and rough sensation, induces free and easy expectoration, viscid, thick, tenacious phlegm, causes continuous hawking, soreness of nostril, sensation about epiglottis as if particles of food remained. Sputum is sweet, profuse and creamy. Hepatica. So interesting, these remedies. So let's come back to Vyathia. Yeah. So this is a remedy I use a lot as well in my practice. When patients with upper respiratory tract infection, they often say that this is the most intense symptom, lot of itching in the throat. Think about Vyathia. So Vyathia 30, frequent repetition, very beautiful change after Vyathia. I show you one more very quick case. In some cases, this is a case of throat infection, 58-year-old lady, COVID positive. This describes a lot of throat pain, throat irritation with a lot of joint pains and hoarseness in voice and she keeps on getting this kind of throat pains, and throat pain is more in the morning when they get up. Thursday, not that much. Generally, she's chilly, likes spices, and she's very emotional. Very emotional. Slightest thing can really, really, really affect her a lot. And she says everything else is okay. I don't know why I'm COVID positive, she says. So this is on very, very vague symptomatology, one kind of presentation which I have seen. And in this type of cases, the remedy that I've used very beautifully, which I want to tell you about today, which I want you to remember as well, is the remedy streptococcin. I generally give this remedy in 1 ml, in some cases 200 also, but generally 1 ml if I get some indications. The main symptom is lot of throat symptoms followed by fever symptoms. And they often get recurrent throat problems. The tongue is very red in color. The patient is very emotional, almost reminds you of pulsatilla. And patient feels better by open air and feels better by continued motion. When I get this symptom complex and also a lot of vague symptoms, not clear symptoms, very often I start with streptococcin rangen. This is such a beautiful remedy. I've used it so often, and it has helped so many patients in the last 2 to 3 weeks that I've seen. The main reason to give homeopathy in current time is they don't have to take kind of paracetamol, Dolo 650 and all that. That's the thing that I'll tell you about. Interesting. That's the thing. How to differentiate with staphylococcinum? Staphylococcinum is not for a throat infection. It's not for fever. Staphylococcinum, majorly I use it for boils and suppurative pathology. A lot of suppurative pathology of the skin. For example, pusses, abscesses, non-healing wounds. That is staphylococcinum. I've written a book called as Materia Medica of Nosodes and Sarcodes. If you get a chance, read about it. Or you can even see some of my videos about this on YouTube. So I gave streptococcinum here, and with streptococcinum, just with 1 dose, her throat pains and everything just beautifully improved. And they even wrote a testimonial for me. Their son wrote, and I'm going to read it for you. Dr. Gaurang and his team are doing a wonderful job. And in the testing time, my parents had tested COVID positive. They have been treated by us. And I must say, medicines have worked wonders. And within 2 days, their health have improved. And it was an interesting case because both his parents and his father also had COVID, and all the reports were very high. And all the doctors suggested you admit him in the hospital. And I spoke to him and I found him okay. And I gave him China. I gave his father China. I gave his mother streptococcinum. And I told them, see, I wouldn't admit them. They are okay. We can manage with homeopathy. Just wait for 2 days. We'll see. And just in 2 days, they were better. And he was a first timer into homeopathy. He didn't know much about homeopathy. And he was so grateful that, how because of homeopathy, I'm able to avoid getting a admission in hospital. And all doctors told me admit, but you are the only doctor who told me don't admit. And I'm so grateful to you. Everyone is so commercial, and just, homeopathic people are so down to earth and want to help people like this. So suddenly they developed a lot of faith. This happens sometimes, but interesting. Feels good. Anyways, let's come back. So now I'm here to talk to you about throat complaints and the main remedies I've used for throat related problems. I told you one of the top remedies is streptococcinum. It's a remedy I use a lot. The next remedy is Vyathia, which also I told you is a top remedy. Typically itching in the throat would be the main symptom. Cistus canadensis is another very, very chilly remedy. And you have to understand, I'm trying to tell you remedies which have a lot of cold draft aggravates because very importantly, you have to understand, because this is the winter season here in India. So dry draft of cold aggravates, and patients say cistus canadensis. I feel like there is a dry spot. There's a spot of dryness, and that is where I get cough. That is cistus canadensis. Cistus canadensis has another very beautiful symptom, which I have used in some cases very beautifully. I show you. Very often, patients who have a lot of fights at home, okay, and after that the cough starts. The remedy is cistus canadensis. Allen's has written very nicely in Allen's register. Cough aggravated by agitation. Mental agitation causes cough. Dekho, cistus canadensis. So beautiful, no? Our materia medica and repertory is so vast. One life is not enough. But I've tried to make a tabular form of it so that you can look at it, see the symptom. About 70 to 80% of your cases will come under these remedies. 20% of cases would require another remedy, maybe individual remedy, maybe constitutional deeper remedy. Yeah. Cistus canadensis subadilla, typically with the itching in the throat, better by eating warm, and the typical coryza symptom. You know the famous symptom of subadilla, isn't it? The main symptom of subadilla, they are very hypochondriacal, my friends. They are very, oh doctor, this throat problem, do you think this could be cancer? Could this be throat related, some very big illness? Fixed ideas. What has Phatak written about subadilla? Last line, first paragraph. Dekho. Imaginary diseases. Imaginary disease. Dekho, imaginary. You have to understand what Phatak writes. Imaginary. Dekho. They are imagining. Array. And next, but very important, they get many delusions. As if, doctor, I feel my throat is shrunken. Doctor, dekho, body part shrunken. Another very beautiful delusion, disease is incurable. Throat disease will end with fatality. Doctor, I think this throat is never going to get better. I will never get better. Subadilla. What if it's a very big illness? Subadilla. Chetna writes like hyoscyamus. Yes, but hyoscyamus is shameless. Antics place. Antics. Hyoscyamus. So interesting. Huh? And the last remedy, but I also want you to remember this remedy, is the remedy Nux vomica. Sore throat. Typically, the main symptom, they say sore throat, rawness in the throat. And this is not noticed on swallowing. So when they swallow, they feel better. This is also typically vomica. So namaste from Mumbai. I am Dr. Gaurang, based in Mumbai. So we have just recently started the course on classical homeopathy. This is a 7-month course. It's a weekend online course, one of its kind, with close to about 20 global homeopaths teaching so much in depth about organon, materia medica, repertory, that I would want to invite every single homeopath there for this course. You can join anytime. It would be 120 hours. It would be only weekends. And the recordings would be available for 1 year. So you will get to see the videos again and again close to 1 year. So that would be a major advantage for any homeopathic student who is either studying homeopathy in college or an intern or a practitioner. There is something for everyone. Once you join the course, you also become part of one of the WhatsApp groups, one of the top WhatsApp homeopathic groups, or a top group that we have curated, where we'll be putting up a case every week and you will be solving cases. So this solving cases helps a lot. Now almost close to 50 cases we have put gradually. We are going to be putting, and you can solve it. That's a very special thing that you could do. Not just about organon, materia medica and repertory, we'll also talk so much about different approaches. You're treating cases of acutes, how we can treat cases of currently acute COVID, how we are using remedies like streptococcinum, pyrogenium, influenzinum in today's acutes, how we are using the remedy China, for example.
Today I saw a case, chills begin from back. One of the top remedies, Eupatorium perfoliatum. So these kind of very important kind of clinical indication. We will also talk about other approaches, how to treat hormonal cases. Here in my clinic in Mumbai, you can see this is my clinic. We are treating many PCOD cases, thyroid cases, endometriosis cases. What is the approach? How I use sarcodes, how I use nosodes, how to use organ specific remedies, how to use backflower remedies, how to use star of betel, how to use biochemics in today's time with cough and cold, little dullness, malaise, whitish discoloration of discharge, tongue white, calimuriaticum 6x, how we are using it. So there are so many different approaches we are going to be talking, and that is why with open arms I want to invite every single one of you. You can join, be a part of us. There are close to 650 doctors who have already joined, and we have a limit of 900 seats for now. So you can write to us, write to me. There will be an entire email ID with all the details of the course below. You can write gaurang@gmail.com, and it would be so good to study with you. Namaste.